Hey, it's Dr. Josh here. I thought that I would just do a quick breakdown on the spine and why you probably have back pain. And that back pain ranging from probably simple back pain to the back pain that's not letting you up off the floor or crawl into the bathroom, or in some cases, patients being dropped off at the back door out of the back of the minivan to get into the room. So this is just a couple vertebra of the low spine or the lumbar spine. And what's going to happen here is that in my understanding and everything that's going on with the disc, there's three components. There's a disc bulge, where it's starting to bulge out of the area. So the disc is between the two bodies of the vertebra. The second one is what you would call a herniation, where the material is starting to push back into the canal where the wires are coming out. So the wires are, the spinal cord and the nerve roots. The third one I would call a sequestration. And a sequestration is what happens when that material actually tears through those ligaments that line the spine and the back, and that material can start to push down into the spinal cord column right there, or what you call pushing through the thecal sac. So what's going to happen here is it's going to cause a tremendous amount of pain. Typically in studies you're seeing anywhere from 20 to 100 times more sensitivity to pain in this area than anywhere else. So what's going to happen is that a bulge, a herniation, a sequestration, depending on exactly where that material pushes out, you're going to put the foot on the hose. You're going to push on the wire. And here's the thing. This bulge that's on this wire right here is called the dorsal root ganglia, or DRG. There's a nerve that comes off the DRG, the dorsal root ganglia, that goes right back into the disc. It's called the recurrent meningeal nerve. That nerve senses the volume and the pressure in that disc, and it's highly sensitive to pain, or pain is like formerly called nociception. And so that sensory feedback to the brain will hit that brain centers with pain, and the response, which you call the efferent response, is going to lock up all those muscles and freak everything out around there. So depending on the extent of the damage, sometimes when you have just a little bit of a misalignment on the tire, or a little bit of wear and tear on the tire, it's going to affect the car a little bit more than when the tire is fully blown out. So you're going to have a lot more pain at that point. I guess my point is that in every low back condition, whether it's minor or major, and like I said, you can't get off the floor, there's going to be a disc component, there's going to be a joint component, and then there's going to be a muscle response. So you got to look at all three of those components when you're actually getting this thing fixed. Taking painkillers is just going to patch the leaks. It's not going to do anything further than that. So when you're dealing with low back pain, number one, don't freak out, okay? Number two, you got to listen to your body. Number three, you have to be in a proactive situation where you can't just brace it and go on and mask it with pain. You've got to be active about it and get that thing reconditioned correctly. That's why you seek out a chiropractor, because they know exactly what to do with these low backs. So coming to you live here. We'll, if you got any questions, email us, call us, view the videos on YouTube, connect with us on Facebook. We'll talk to you soon.